Today I'd like to talk to you about the SaeboStretch, also known as a resting hand splint or a nighttime splint. It is used for individuals suffering from stroke, traumatic brain injury, spinal cord injury, and cerebral palsy. It is used to prevent contractures or minimize soft tissue shortening. One of the unique features of the SaeboStretch includes a dynamic handpiece. With the traditional static splints that are on the market, when the patient has tone or soft tissue shortening and they do what's called an associated reaction, where they laugh, they sneeze, they get up out of their chair, the tone kicks in and the fingers want to pull out of the splint. That causes a lot of pain and joint damage. With the SaeboStretch, we have a dynamic energy storing hand plate. So when that tone kicks in, instead of the fingers pulling out of the static splints, the fingers will move into flexion to protect the joints. And when the patient relaxes, the fingers will safely reopen to that neutral position while still maintaining a nice stretch on the long finger flexors. It comes with 2 additional hand plates. Depending on how much tone the patient has, the clinician might put in a stronger hand plate or a weaker hand plate. Some of the additional features of the SaeboStretch include the malleable wrist mount, as well as the malleable thumb mount, so you can position it exactly where you want it, depending on how much tightness the patient has. We also have non-slip straps, so the fingers stay exactly where they need to stay. There's an individual strap for the 5th digit, and that's important because the 5th digit is a lot smaller than the other fingers. No other splint on the market has an individual strap for the 5th digit, so that's pretty important. We also have a breathe-a-preen cover. That's a cover that wicks away moisture. You could also remove it so you could wash it. One of the other features is a palmar pad or a palmar arch, and that's in there to preserve the palmar arch when the patient's wearing the splint.